So I hope you're all feeling energized and ready for day two. We're starting the day with a session that really sits at the heart of what the shed movement is all about. In many ways, this is a centerpiece conversation for the entire ShedFest program because while many sheds may not talk about health directly, in fact, most of them probably don't, the impact they have on men's health and well-being is really profound. So this session will explore the idea of health by stealth. Has everybody heard that term? Yeah, yeah. And it's how sheds support men through isolation, life transitions, and health challenges. We'll also be sharing new insights and data that help tell the story about this more clearly. And importantly, we'll look at how the men's shed movement can play a role in the growing national conversation about the health and well-being of men and boys. So first, we'll hear from Catherine Corriveau, who's the Director of Policy and Advocacy with the Movember Foundation, which I think you've all heard of, Movember, the mustaches. And who's from the shed that did that great Movember birdhouse? Great. Love that. I should have got a picture of it. I'll try to do that because I think the Movember folks would love to see that. So Catherine will set the stage with key findings from the 2025 report on the real face of men's health in Canada. And then I'm going to build on that a little bit by sharing some data that's specific to Canadian men and older Canadian men. And then next, we're very pleased to be joined by Dr. Raza Mirza, COO of HelpAge Canada, who many of you will have met yesterday because he's been with us throughout ShedFest. And he's going to share for the first time, so you'll be hearing it here first, the results from a Canada-wide survey of shedders that is offering very powerful insights into the impact sheds are having on men's well-being. And he's also going to provide an opportunity for you to engage in the presentation in many different ways. How many of you actually participated in that survey? Buddy? Wow, great. Well done. We're also going to hear from Karen McDonald, the Executive Director of Sage Seniors Association in Edmonton, who many of you probably know and certainly will know Sage. And Karen has been an early champion of men's sheds in Alberta. Karen also brings a national perspective in her role as the co-chair of the Pan-Canadian Community-Based Seniors Services Council. And she knows firsthand the role of community spaces like men's sheds in supporting the pillars of healthy aging, being active, connected, and engaged. And her organization, Sage Seniors Association, hosts the Gujarati Men's Shed that you heard Secretary McLean say she visited when she made her remarks yesterday. And some of you will have seen that Movember Canada report. How many have seen that report? Real Face of Man's Health. Oh, not that many, actually. Okay. Well, you'll hear a little bit more about it. How many tuned into the webinar we had last year that featured Dr. John Olaf, who was the primary author of that report? Yeah. So Karen, or Catherine's going to discuss these findings, which are quite concerning. And we're continuing to work with Movember. And although Catherine was unable to be here with us in person, we're very pleased to have her share more insights from Movember's work through a recorded presentation. So,
good morning, and thank you for having me. My name is Catherine Corriveau. I'm the Director of Policy and Advocacy with Movember Canada. I'm so sorry I couldn't be with you today. I really wanted to come to Edmonton, but Ottawa had other plans for me this week. I'm so honored to be speaking today and to be engaging with your community who has really made a huge difference in how we understand the way that we engage men in care and in community. At Movember, we've been doing work for men's health for over 20 years. And in the last few years, we thought about what would happen next, where we could intervene next to make sure that we could have long-term sustainable change to make sure men, boys, and their loved ones have longer, happier lives. We released a Real Face of Men's Health report, which was the first comprehensive picture of men's health in Canada. understanding why men were dying too young, how much they were dying, and what were pathways forward to make sure that we were engaging men in a way that was productive and supporting existing healthcare infrastructure. So we started doing work around policy and advocacy. A metaphor or image I like to give oftentimes when I talk about my work is if you have a pond that's full of fish and all the fish are sick, at some point you have to stop treating each individual fish and start looking at the water and who's putting the water in the pond. When we think about the water in this case, we think about policy infrastructure, we think about healthcare services, and when we think about who puts the water in the pond, it's the government. So my job every day is to go to government and make sure that they're thinking about men and boys, not just as an afterthought, not just as part of a bigger population engagement, but really as a dedicated part of a strategy that government will undertake to make sure that the services they're giving, the programs they're funding, and the research they're advancing really tackles the unique needs of men and boys. Because the reality is, too many boys and too many men are dying too young, largely of preventable causes. Cancer, coronary heart disease, suicide, they're all causes that we know and how to prevent. Suicide is the second leading cause of deaths for men ages 15 to 44. And all of that is happening because of reasons we know. Harmful masculinity norms, that sort of toxic sense that men don't cry and you have to man up. And so we think that this has not just impact, and we know this doesn't just have an impact on the men, but also on their loved ones, on the caregivers who are overwhelmingly women. 70% of them are women. They report having worse financial, physical, and mental health outcomes as a result of being caregivers. It also has an impact on the economy. Poor men's health costs Canadian taxpayers $12.4 billion in just 1 year. Think about that. $12.4 billion. Imagine if we could use that money for anything else to make sure that we were building up the capacity of our country. And there are real opportunities for us to be engaging men, not where we want them to be, but where they actually are. Our program at Men's Shed is actually a great example that we often talk about in government meetings. We say, instead of making the men use the services that they don't want to use, that they don't feel work for them, let's meet them in spaces where they are, where they can connect with each other, and where they can build something with purpose. So Men's Shed is a great example of the type of pathways forward. Because part of the problem is not just that men don't necessarily engage in care, and that's a real problem, right? A majority of men will wait for up to 6 days with serious symptoms. 1 in 10 Canadian men will wait for up to 2 years actually before they engage with a healthcare provider. And that's with serious symptoms, right? I think we can all probably know someone or are the person who hasn't gone to see the doctor in time. But then if they do go in care, they're not actually getting the care that they need. A majority of men report feeling dismissed, ignored, and misdiagnosed by doctors who don't necessarily know how to speak to them. So we're telling government it's time to do something about it. And they have been doing something about it, which is really exciting. And a lot of my work is actually just making sure that we can help support the federal government in thinking about having a dedicated strategy, have a dedicated roadmap of interventions and funding investments, so that we can make sure that those numbers go down, that men live healthier lives, that their loved ones, their community are stronger, more resilient, and that we equip our workforce so that they know how to engage men in care. And finally, that we rethink the way that we do healthcare in this country. It's not just about making people come to us, it's about meeting them in their spaces, be it a men's shed, be it in an arena, online gaming, in, community spaces. We really have to be creative about how we think about that engagement and care. And this is what we're here to do with the government. So I'm very happy to be seeing that work being done at the national, federal level. There's actually an opportunity for everyone, every Canadian, to submit their recommendations to government as to what a strategy, a good, strong strategy could look like for Canadians. and also eventually provincially as well. You know, provinces being mandated to deliver the care, they have a real role and opportunity to make a difference in men and boys' life. So thank you again for having me today. Again, I'm sorry I couldn't be there in person. I really wish I could have. But I'm really looking forward to partnering with organizations like Men's Shed and ensuring that we move the needle forward for men, for boys, for their loved ones, and for our country. Have a great day.
Movember's report should serve as a wake-up call. A key statistic cited there is that 44% or more than 2 out of every 5 Canadian men die prematurely, that is, before the age of 75, from largely preventable causes. And I personally know the names and the faces of some of those men. So let's take a look at some of the data related to older Canadians. As of July 1st, 2024, approximately 19% of Canada's population was aged 65 and older, totaling over 7.7 million seniors, according to Statistics Canada. This demographic is the fastest growing in the country, and within those numbers, the 75 plus age group is growing even faster than the 65 plus demographic overall. The increase is driven by aging baby boomers and higher life expectancy. The Atlantic provinces generally hold the highest concentration of seniors, followed by Quebec and BC, while the Prairie provinces are at the lower end, but still significant numbers. Life expectancy has risen to over 82 years, though a 9-year gap exists between average life expectancy and healthy life expectancy. At the same time, most older Canadians continue to live independently, as do 80% of men aged 85 and older, with about 30% of them living alone. Next slide. While living alone doesn't equate to social isolation, it can be a factor, particularly when due to divorce or widowhood, along with other factors such as retirement and health problems. Other ongoing challenges for men can include loss of identity and loss of purpose that may come with retirement, a reluctance to seek help for physical and mental health concerns, and experiences of ageism in the workplace, the healthcare system, and even in the family, which can at times extend to elder abuse. And for many, financial anxiety and/or insecurity is a reality, which is a challenge enough, but which can also contribute to social isolation and physical and mental health problems. So for many of these challenges, men's sheds offer relief and a remedy, what we often refer to as health by stealth. I don't need to go into detail on what this looks like because you see it and experience it in your sheds, and we've been talking about it here at ShedFest. But what's behind what President Robert Golick often refers to as the magic that happens in sheds? And what does it look like collectively? What is that difference that sheds are making in the lives of shedders and their communities, and why does it matter? To answer these questions and more, I'm now going to invite Dr. Raza Mirza to share the results of Canada's first national men's shed survey. Besides serving as COO of Help Age Canada, Raz is an assistant professor with University of Toronto's Institute for Life Course and Aging, as well as a member of Men's Sheds Canada's research committee. So he's very well positioned to have undertaken this research and present it to you today. So please join me in welcoming Raza.
Thank you so much. Okay. Thank you very much. So I'll start with an apology first. Where's Tyler? Is he here? I was wearing an Oilers shirt yesterday, but I'm a Leafs fan. Okay. I'm really sorry. I know that's the most controversial thing I'll say this morning. I'll start by saying thank you very much to the research team at Men's Sheds Canada. The work that I'll talk about today was funded by Men's Sheds Canada, and I'll share some of the very exciting details here as well. Now, the other thing that I will tell you is that there's some sticky notes and some pens that are on your tables because there's a few more questions that I'm having a hard time addressing. So I'll ask you for some help with that. Okay, let's get started. And I'll just tell you a little bit more about Help Age Canada. So for those of you who don't know about Help Age Canada is a national charity and nonprofit, and it's been around for around 50 years. And we've been supporting men's sheds, and men's sheds have been supporting us as well. And so if you don't know about Help Age Canada, I encourage you to go to our website and learn a little bit more about the work that we're doing. Now, here's the part that it gets a little bit interesting when we talk about things like health by stealth. How do I explain that, and how do I tell people what health by stealth really is? And actually, I'll tell you a little bit more about a couple of people that I've met, and I've really enjoyed meeting a lot of you as well. So here's one of the first things that someone had said to me while we were doing this research work. My wife asked me what I did at the shed today, and I said nothing. I did nothing at the shed. But you know, nothing is something. Being at the shed and with the guys made all the difference for me that week. You know, and so this is what health by stealth actually looks like. And I will tell you that that talk yesterday by David was so inspiring that I changed some of the information that I'm going to present to you today just to tie into some of the things that we discussed yesterday as well. Now, the second story that I'll tell you is that I met this person and they waved at me. They looked at me right in the face. The second person I met, and they looked at me and they said, you know, most days I have to do this. I have to wave at people right in their face and say to them, I'm 67 years old and I'm retired, but I'm not dead yet. And I feel invisible. And yesterday, when we were talking about the morning and the evening and that liminal space, and I'll talk about that a little bit more today, it's actually that afternoon period, that liminal space where people start to feel invisible. And I'll talk a little bit more about the risk factors associated with that liminal space here as well. Now, the other thing that I can tell you is that I'm biased now. And as a researcher, I'm supposed to be objective and I'm neutral, but I'm not anymore. And the reason why is I spend so much time in the sheds and with the participants in sheds that I'm super hooked. And I've been telling this to anyone who would listen to me at the lunchtime and at the dinner time. And so, you know, I really bought into this idea, and I really, really appreciate all the work that's happening here. One of the things that I really struggled with about 3 years ago is understanding what a men's shed is. So I want you to imagine yesterday, one of your colleagues stood up and said, hey, guess what? People don't know about men's sheds. And when they learn about men's sheds, they don't really understand what a men's shed is. And so people were asking me and they're saying, oh, you're going to Edmonton. What are you doing? And I said, I'm giving a talk about men's sheds. And they said, wait a second. So men get together in sheds? How big are these sheds? And I said, no, 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 no. That's not how it works. And, you know, I started to pick up some of the literature that's been on the table. And, you know, men helping men. I'm trying to explain this, fostering a supportive community where men can engage in meaningful projects. And on the panel yesterday, someone also said, why do we need to define what a men's shed is? And I agree. I don't know if we necessarily need to define what a men's shed is, but we actually need to be able to explain what it is and how it functions. And so if you could help me, I wouldn't mind your help. And once you're done, you could just raise your hand with your sticky note. When you think about a men's shed and someone says, where do you go on Thursday morning when you go to that men's shed? How do you describe what a men's shed is? So if you could take a sticky note and just write it down, and you have something for me, which is a formal definition, a supportive space where men of all backgrounds can gather to connect, share skills. And this is important. And the reason this is important is because when I look at the definitions, including the one that was presented yesterday by David, there's at least 17 different definitions. Okay, and I'll share the one that's in the literature shortly, but I really just would like to know from you, what is a men's shed to you? Okay, is that all right? We'll just spend maybe just 30 seconds doing that. And once you've written it down, if you could just raise your hand and we'll collect it. And I'd like to put it up here where I'll answer some of these, or we'll work together to answer some of these questions. What is a men's shed? I'll pop this one up there. Is that all right? Yeah, okay. Oh yeah, sure. Thank you. Okay, how are we doing? We're good? Now, I'll tell you the way that I've started to describe it. I started to describe it as a community social anchor. Does that resonate with you? A community social anchor. No, it doesn't resonate with you? A social anchor like institutions like education or spiritual places, kind of? Yeah? Okay. here's the formal definition for it that's found in the academic literature. So one of the first things I started to do when I was learning about men's sheds is to think about the ways that it's identified across the world. And here it is, a community-based group providing a safe, friendly, inclusive environment to gather and participate in activities. Okay. Now here's this is the second most difficult question that I'll ask you this morning. Why do we need a men's shed? Okay. Why a gendered space? Why do we need a gendered space? Because this comes up a lot. Okay, so that'll be the next sticky note that if you can help me answer, and I'll tell you the answers that we have. Why do we need a men's shed? Just for men? Is it an exclusive group and it's only for men? The data suggests otherwise. Any thoughts about that anyone wants to share? Why do we need a men's shed? Because from the White Rock men's shed, what it says here is where men get together and do guy things. Okay, and it's important for us to be able to explain what that means. And why do we need a gendered space? Yeah. Okay. And I'm hearing some of the comments and saying where guys can be guys. Yeah, no, I'm hearing it. And it's not the first time I'm hearing it. It's actually something that I heard a lot in the conversations that we had in the surveys and the interviews in the focus group. And actually, I want to go back to something that we heard from Catherine earlier. And Catherine is actually saying a lot of the issues that we're dealing with are gender focused. The isolation that older men are facing, the risk of suicide, gender focused, okay? And actually, the fact that older men are not necessarily going to go to a bereavement group, they're not going to go to social services, they're not going to go to therapy because that direct approach doesn't necessarily work with older men. So this indirect approach that Men's Sheds presents is helpful. Now, did any of you write down on your note about why do we need a men's shed, specifically gendered? Did you write down because older men are vulnerable? It's a vulnerable group? Are they a vulnerable group? What do you think? I would say they are actually. And what their risk factors are highlighting is that they're quite susceptible to things like isolation, to suicide risk. And again, that liminal space that afternoon is really tough. Yeah. Did you want to add something? Yeah, sure.
I think on that note, something that me and my wife have recognized, a lot of previous cultures had boys' rites of passage for men. And in our society, a lot of those rites of passage have changed over the years. They might be going to college, getting a job, starting a family, but we don't recognize or we don't have a proper system of honoring those proper rites of passage. But by being in a men's shed, you're heard, you're understood, you're seen, and that can do a world of help for your self-image and your self-worth, because now there's a group of men that can honor you properly and they see you for who you are. So
Thank you so much. And I think that point, and I'll get to Brody as well shortly, because we talked about intergenerational engagement and ageism within the sheds as well. Now, the other point that I will say is that it's a space where you can honor masculinity, where your identity is actually safe there. And this is something that we hear here as well. Now, one of the challenge areas actually in conversations with folks here is to say, it's amazing to hear a lot of the stories, and we've heard stories, but how do we translate the stories into meaningful data so policymakers and others can respond to it in a meaningful way? And I think that the data that I'll share with you, it's just a very quick snapshot of some of the things that we heard. I think it's really important. What I will say in the conversations and from the panels that we've had so far is that the evidence is fairly clear. Men's sheds and the participation in men's sheds is actually changing people's lives. And I'd go as far as to say it's saving people's lives. And from the conversations that we had yesterday, it's also saving people's marriages. Yeah? Because I heard people say, oh, you know what, my marriage is better as a result of this. Now, this is what framed the conversations and the interviews and the surveys and the focus groups that we had. So very boring detail, but I'll share it with you really quickly. We did this review of all of the literature. So thousands of articles about men's sheds and men's mental health. We got to 4 themes. I'll point them out to you shortly. We've done surveys with over 250 shedders across the country. Now, we also did the quick math to say if there's 200 sheds and there's about 30 people per shed on average, it's around 6,000 shedders across the country, probably more than that. And so we have a snapshot of about 5%. And so we're aiming to do the research and the evaluation on an ongoing period of time to be able to report back what the benefits are. Now, here what you'll see is that a lot of the studies that we reviewed said that they were quality of life improvements. And I'll just take a show of hands to say, would you say that your quality of life has improved as a result of you being in the shed? Yep, our survey data says the same thing here. One of the points that I'll make about quality of life improvements is you'll see right here, increased self-esteem, sense of purpose, reduced alcohol consumption. So risky lifestyle behaviors reduced because coping strategies changed as a result of being in the shed. Now, during the life transitions, that conversation yesterday, I have to tell you, super emotional, especially around the life transitions. And the point that I want to make, and I want to get to that very quickly here, is this idea about the morning and the evening. Do you remember that slide yesterday? Now, I want you to just think about something that I've reflected on and tell me if you agree with me. The morning looks different for everyone. And that afternoon, that liminal space looks different for everyone. And that evening looks different for everyone. And 2 examples that I will give you is that one of the shedders that I met, 44-year-old guy, his morning actually was cut short because he was laid off and he has nowhere to go. He loses his sense of identity, his purpose. So he finds a shed and he's able to participate in the shed, and that actually helps him get to the evening part of his life. Now, the other part that I'll share is that the evening looks different for some folks as well because they're going through a late life divorce. Their wife is sick with cancer. So the evening and the morning look different for folks. And I'll say this again, is that the afternoon, that liminal space is where we lose a lot of the older men. So that suicide conversation that we're having, the isolation conversation that we're having is really about that liminal space where one thing is ending and you're having a new beginning to something, but it's actually quite difficult because oftentimes what people are doing is they're looking back and saying, wow, that morning looked way better than what that evening has to offer me. And so that becomes quite challenging. And the final point I'll say about that morning and the evening part yesterday is the last question that was on that slide about the morning was actually, who will go with me? Do you remember that? There was a question that was asked yesterday, who will go with me? And I'll get to that shortly here as well. Now, health promotion in gendered spaces, we see that happen with women's groups as well. So this is not an exclusive group for men, but it is a place where you can get indirect support and help, where it's about intention, it's about skill sharing, it's about mentorship. So this is the purpose of having a gendered space. Now, that other point that was raised yesterday really struck a chord with me, the casket discussion. You remember that? I don't have enough people to carry my casket. Oh, really struck a chord with me. Now, I'll ask you this one here, and there's a reason I'm asking you this. If you have good news to share, how many people could you reach out to and pick up the phone and say, hey, I won the lottery? Or one of the raffle prizes. Okay. And if you had bad news to share, the Oilers lost in overtime. Who could you share that with? Okay. Now, could you put a number to those? Okay, on your sticky note, if you don't mind, just put that number down for me. So there'll be 3 things here. The number of people you could call if you had good news to share, the number of people you could call if you had bad news to share, and then if you didn't show up to the shed for 1 week, would someone pick up the phone and call you? And that's a yes or no. Or they might text you if you're a younger person. Yeah? And the reason I'm asking this question is I'll talk about natural supports in just a second. How am I doing for time? Am I talking too much? No, I'm good? Okay. Because I'm known for that too. Yeah. Okay. Do we have a number for this? How many people could you call for good news and how many people for bad news? Now, think about the people that you would call for the good news and the bad news. Are they the same people? They're the same people? Okay, interesting. And then if you didn't show up to the shed for a week or 2 weeks, would someone call you and say, hey, where have you been? They would? Great. That's very health protective. And the reason I'm asking you this question is because what you'll see from the data is that participation in the men's sheds programming has actually allowed people to recreate their social network. The afternoon period, that liminal space that David talked about yesterday, is a point where people start to lose connections to other folks. And the men's sheds programming has been able to help, again, rebuild social networks. And the reason I'm calling it a natural support is because when I asked this question in other groups, the people that folks would call are healthcare professionals. They would call their therapist, they would call their social worker. And that is not a relationship which has reciprocity built into it. This is not a true friendship. And so these are natural supports that are often recreated through participating in men's sheds. And what you see with a lot of older folks is that their natural supports are not natural. They're actually healthcare professionals. And there's a boundary to that. There's a limit to that. Now, engagement with others, and Brody and I, we were talking about this yesterday, the real benefit of these sheds actually is to the larger community. The intergenerational engagement focus is very key here. But there's a barrier to entry, and that's the exact language that we had used yesterday to talk about this. And the barrier to entry is actually ageism. The ageism that sometimes is held by younger folks towards older folks towards younger folks, and actually the ageism that people put towards themselves. So there's self-ageism as well, to say, I'm too young to participate in a men's shed. Okay. And one of the other things that we heard in the conversations yesterday is that sometimes outside of our world, within the men's sheds world, men's sheds is seen as a retirement club, as a social group for older men. And so these sorts of narratives become problematic when we're trying to recruit and do some outreach. We all know that's not true, but it's part of the messaging that we have to be able to address the ageism that is inherent in some of the work that's happening with men's sheds and some of the narrative that is being shared. So what this all says is that, these are real points for us to be able to address. We need to be able to explain what men's sheds are, why we need gendered spaces, and really what the benefits are. And this is an inclusive group. And I think that's really important, is to say it is a gendered space. It's bringing people to a place where they wouldn't necessarily go to if the narrative around it was to say social services, therapy, bereavement, as I mentioned earlier. But if it's, again, intentional mentorship, etc., that's a place where older men might go. Now, another gentleman that I spoke to said, I'm 64, I'm one of the young guys in the shed. And you're right, you are one of the young guys in the shed, because what the data is showing you is that about 64% of the folks that are participating in men's sheds are over the age of 70. What the profile is not highlighting to you here clearly is who these men are. And I think it's really, really important for us to be able to tell people the story, and the larger data set is going to include that. There's doctors, there's lawyers, there's data scientists or communications experts. There's lots of skills and expertise that is in the shed. And in the final things that I'll say is be a person of value. You remember that message from yesterday? These are people of value. And what we need to be able to do is make the value more visible. And that's part of the work that we're doing here as well. Now, 97% identify as male. And so what you'll see is that there is inclusivity for 2S LGBTQIA+, and also for women to join sheds as well. Now, this is the stuff that I get quite excited about, so I'll try not to spend too much time on it. But again, men's sheds are working. The data is fairly clear here. 45% are comfortable approaching other shedders. So the mutual aid and support that is provided within the sheds, the stories that we're talking about, the information that's being shared, the coffee chats that were discussed yesterday, and many of you have these coffee groups. These are the benefits of those coffee groups, those coffee chats, and those informal discussions and the presence that the men's sheds are having here. Advice about maintaining physical health and mental health as well, okay? Half of you are talking about these issues with other men that are participating in the men's sheds. Majority of shedders are at least somewhat comfortable discussing the difficulties that they're experiencing. Okay, now I want you to ask yourself this question. If you're not in the men's shed, if you're not with other men, who are you talking to about these issues? No one. Yeah, I heard that loud and clear today, and I've heard it loud and clear over the last couple of days, and the data also says this very loud and clear. And these are some of the implications of this here. One of my second last questions, what helps you get through a difficult day? If you could just write that down on your sticky note, and I'll tell you some of the things that we've heard as well. What helps you get through a difficult day? Or you can still put it on your sticky note though. Yeah, it's fine. Yeah. Sorry. Okay, how are we doing? Any idea how people would respond to this question on a survey or during an interview? Well, prior to joining a men's shed, people would say things like, I would drink a lot, I would consume cannabis, I would do sort of things that I know are unhealthy for me. But after joining a men's shed, I actually would just go to the shed. I'd go to the shed, I'd participate in shed activities. And actually, that's what would help me get through a tough day. I had a new network of folks that I could talk with. And I think the key point also about this here is something that we heard from David yesterday as well. I went to the shed not because I wanted someone to fix me, but I just wanted to be heard. I wanted my issues to be visible to someone. In case I needed help, I knew I could turn to someone and they would know that I would need help. Now, this is, I think, the most important slide here. And it goes back to the point that was raised earlier, that question on that first morning part. Who will go with me? Who will go with me? Through the liminal space to the evening, 27% occasionally felt isolated and or lonely prior to joining the shed. And if we did the raffle version of events today, everyone numbered 1 to 50 would be in that group of people who would say, I feel isolated or lonely on a regular basis. Okay. And isolation and loneliness has its own mortality risks and all sorts of other risks associated with it. After joining the shed, 76% report that they have stronger social connections and improved quality of life. So now we're looking at numbers 1 to 112 based on your name tag would say, actually, I feel like I have a stronger connection. And 49%, almost half of the folks that were in our research, have made 10 or more connections since joining the shed. 10 or more connections since joining the shed. So not only has the shed facilitated the improvement in quality of life, but has actually expanded the person's social network. Okay, so if I go back to that question and I said, who would you call or how many people could you call for good news or bad news? Guess what? You have a whole range of new connections that you would call and a whole group of people who are not getting you to think about your casket anymore. They're saying, hey, we've lots of work to do. So who will go with me? Well, 10 or more connections here. The other point on this one here is, about this physical activity. What are the engagement points here? And we had this conversation yesterday at lunch and dinner as well, is that a lot of folks were talking about the fact that, I don't want to do activities on my own. I don't want to go to the gym or exercise or go for a walk or join a walking club. But you know what? If the guys are doing it, I'll do it too. And so what you'll see is actually the positive experiences related to things like physical activity and lower engagement in other high-risk behaviors, indicating a positive general lifestyle pattern. All things quite important here. Now, key takeaways from the survey data, and I'll whip through some of the other data very quickly here. Men shed work, they reduce isolation. Belonging matters. And so the belonging part yesterday was raised, by Punch Jackson saying, we need to connect the dots. And Robert also highlighted the fact, and Brian, that men shed are actually an infrastructure of belonging. And belonging is not engagement. Belonging actually is about creating a space where people feel psychologically safe, they feel welcome, and they feel valued. And I think that's a key part is of this work here. Here's a quote from one of the interviews here. It's not just us shooting the breeze. To get to know guys, you have to work on a project. Guys are not going to sit around and talk about anything. This much I learned because I was trying to do some interviews and do some surveys, and they were like, no, you can't do this. We actually have to walk around and do work, and you can ask us questions, and we'll answer them. And that's the way I did some of the interviews and focus groups. It's very important to have a shed, a workplace where guys can get together and work on stuff. And so what Health by Stealth looks like is this. Now, the interview data also just highlighted to us that it's not a hobby. It's not a hobby space. It's not a place where people hang out because this is a retirement social club. And even if it is a day where people are just hanging out, it is making a big difference for folks here. And the other point that's important from this particular slide here is that emotional support is built into the culture. There's not a direct approach to emotional support. but sheds strengthen community. And so far, what I've been talking about is what the impact is on you. And a question that is sometimes also asked is, if the shed was to disappear from the community, what would be the impact on the community? Because what it appears when we talk about men's sheds is that it's a benefit for the participants. And the reason we did this research is actually to highlight what the benefit is also for the community. Now, this is my final question, I think. Yes. How does the participation in men's sheds benefit you? You can use a word or just anything you'd like to say. This is what the benefit has been for me. And then how do you think this participation benefits the community? How do you think it benefits the community? Does it create a third space? Does it create opportunities for others to be able to engage with you? The bike repairs, all sorts of other ways that communities benefit from. Yeah. Any quick thoughts while we do this exercise? Yeah. Your shed does lots of projects, and yeah, that's right. Okay. That benefits and to you as well. So there's a mutual benefit. So the work that you're doing for the community is actually beneficial to you as well. And we saw from David's presentation yesterday that they have a whole list of community partners that are reaching out to them and saying, can you help us? Can you support us with some of the projects that we're doing? Now, we did some case studies also. So we got very carried away with this research. We started off by doing this huge literature review. We did surveys, we did focus groups, we did interviews. Then we did some case studies actually to look at what the impact is on communities. And I'll wrap up shortly with a few more slides here. Now, part of this is about creating a community space. So yes, it's a men's shed. Yes, it's a gendered space, but it's also becoming a community space. So there's a lot of the sheds have open houses on the weekends. They have craft fairs, and it's a very inclusive setting for folks. But it's also reframing and making that older man who's feeling invisible, visible again in the community. There's a presence, there's an identity. And the identity part that I'll share with you is this one thing that I hear quite a lot. It's the recreation of an identity. Do you know what it sounds like? I'm a shedder. I'm a shedder. That's a new identity. Yes. It gives you value. Yeah. Mhm. And I can tell you that the communities really do value the contributions that are being made by Men's Shed. And it's to your point yesterday that you raised when you stood up after the panel to say, actually, lots of folks don't know about Men's Shed still, and we have to work a bit harder to do that. And I hope that some of this research and data will allow us to do that. Yes. Oh, it's Raza, please. Yeah. It's just Raza. Yeah. Yeah. Well, the addictions pieces, we've asked questions in the survey, in the interviews, in the focus groups. And what we can see is that some of the data that I shared here is that it's not necessarily tied to addictions, but it does lower risky lifestyle behaviors. But it's a very important question in terms of, people with addictions, do they find the space to be a place where you can discuss addictions, where you can talk to others about addictions and ways through addictions? I think it's worthy of exploring that. Mm-hmm. Mm-hmm. Is what, sorry? It's fentanyl, yes. Mm-hmm. Mm.
One of the studies showed that one of the big things to help with the addiction, or what the people that have the surgery that other people don't have,
Mhm.
is that connection with the community, a sense of belonging,
Mhm.
a sense of being accepted. So
Well, I think what I've seen from the data, and it's a very valuable point actually, is that men are going to circumvent some of the formal processes. So even if you have addictions, to go to social services, to go to therapy, to go to recovery group. But actually, if you were to bring the services to the shed and to bring the services and the supports to the shed, that it might be an important place for an intervention. And oftentimes the shed is seen as the intervention. And really, again, this is about purpose and identity that I've been talking about. And this is all tied back to emotional health and well-being that is not often directly discussed in the shed. I'll close off with a couple other points. Yes, sure, of course. Thank you. I'm not alone. Yes. Hmm. Wonderful. Hmm. Okay.
Physiotherapists, or psychologists, things like that. I brought them in for one day a month. People in the area registered, but then they found that their registrations were just getting overwhelming.
Mm.
Started actually getting outside their gender, and they were.
Okay. And it's going to sound like we set this up because it's going to tie in perfectly to what I'm saying here, and it's an Ontario connection too. But I'm sorry, but it's exactly right. Is what you'll see is that men's sheds is now getting connected to other systems of care and support. For example, social prescribing that you may have heard of, preventative health systems and supports. So actually, the services are being brought from point B back to point A instead of it being taking people from point A to point B. And so that's an important key piece here as well. And now the question sometimes asked is, well, what is the difference it's making? Well, in terms of our healthcare system, if older men are providing mutual aid and support, and we're not going into emergency departments because people are feeling isolated, they're feeling lonely, they're feeling anxious, those are system savings. And are we ready to make a declaration in terms of what the system savings are? Not yet, but we're moving towards that as well. And I think this is a visual that I use now sometimes when people say, what are the benefits of men's sheds? And I say, I can't do a good job of explaining it, but I can show you a picture. And this picture really highlights the impact on the individual well-being, on the community well-being and the cultural value, strengthening local communities, really highlighting also the fact that men's sheds are adaptable, they're agile. We don't really need to have this rigid approach to it, and it's really, really working well. And I'll leave you with this final quote here in terms of the value. The other point that stuck out to me from David's talk yesterday is be a person of value. And here's a quote from someone yesterday saying, people ask me if I'm retired, and I look at the number of hours I put into the shed, and then my grandchildren and kids and all that. I'm not retired. I simply stopped doing things people had to pay me to do and keep doing things I like to do. So I'm still engineering, I'm still designing, I'm still, working with teams, but it's a team that I choose that no one has built for me. And it's a great quote, right? And you know what? I'll just follow up by saying I did this super annoying thing and I said, do you think you could put a dollar value to that? And so we did. And this person's dollar value, because remember, this whole idea of value is $77,000 for the year put back into the community, and that's one shedder. $77,000 worth of value put back into the community. So back to that question, if the sheds were to disappear from our communities, what would be the disadvantage? Well, it looks like this. And so I'll just close by saying that while I've been here since Sunday and I've been really excited and meeting people, people have been asking me, what shed do you belong to? And I don't belong to any of the sheds yet, but this is going to sound cheesy, but this is how I really feel. I feel like I belong to all the sheds now because I've met so many of you and I've read your interviews and surveys and participated with all of you. And I really, really appreciate the hospitality and the welcome, not only for myself, but for our research team. And I look forward to our work together. So thank you so much. Thank you. Yeah, good.
Great. Well, thank you so much, Raza. We're going to hear from Karen in just a moment, but I'm really interested in hearing that figure of 77,000 just from one shedder. For those of you who are not attending the concurrent session on research that Raz and I will be doing later after the break, that is something we're going to probe a little bit more deeply is what is the social value of sheds or the social return on investment or that, cost benefit analysis? Because we've got an interesting project just getting underway around that. So if people who are not attending that session want to know more, let me know and I'll fill you in a bit. Now I'm very pleased to welcome Karen McDonald, who is going to speak for a bit and just fill you in on some of the things from her perspective as a longtime ambassador and fan of men's sheds.
Hi, everyone. I'm so excited to be with you all today. For those of you who I've met before, who or maybe you've heard me speak before about men's sheds, this is quite frankly my very favorite group in the sector. So my name is Karen. I'm Executive Director of Sage Seniors Association, which is a community-based senior serving organization here in Edmonton. And I'm also Provincial Director for Healthy Aging Alberta. And Healthy Aging Alberta helps to coordinate community-based senior services right across Alberta. And then I'm very excited to co-chair the National Community-Based Senior Services Leadership Council with Robert, who's with the National Men's Sheds group. And so I'm involved in men's sheds in a variety of different ways. And today I was asked to be here just to talk a little bit about how the community-based senior services sector, I think, can support the good work that you're all doing in community. I first heard about men's sheds about 10 years ago in my role at Sage. I think it was about 10 years ago, maybe longer. And I just remember instantly understanding why this was so important and being so excited. And I have to say, Raza, when I was listening to you today, I was actually getting a little bit emotional. I don't know if you guys are feeling the same way, but seeing the data, the hard numbers, just really reflects, I think, what we all intuitively know in our hearts about the value of this important work and the spaces in community. I'm getting emotional again. It's just so good to have the concrete data to support the stories that we all hear and the impact that we all see in our communities and in the lives of the people that we care about. I think for folks like myself, when we're having the conversations with folks in government and policymakers and the people who hold the purse strings, we can tell the stories, but being able to have the research and being able to attach numbers to the impact of the work that you guys are doing is really important. So thank you, Raza, for that. That's really, really exciting. So today, I just wanted to talk a little bit about how folks like myself that work in these community-based organizations and in systems can support the work of shedders, and how we can work together to really have that positive impact in the lives of men. In our role at Sage, years ago, when we first got really, really excited about sheds and the potential of how we could support that work, what we learned early on is that our role was not to create a shed. We weren't going to build a shed. When we learned that a shed wasn't actually a shed, we learned really early on that our role was to create space for men to lead, and our role was to enable that work. Our role is to share resources, to do everything we possibly can to advocate for investment in sheds, to share power, so to make introductions with folks who are in positions where they can invest in the work that you all are doing. As an executive director of a community organization, to share space, quite literally space. In our role with Healthy Aging Alberta, we've really benefited from the work of shedders, to be honest. We have something with Healthy Aging Alberta, and my colleague Amanda is here, who's also with Healthy Aging Alberta. We have a service model, which works to articulate the work of community-based senior services to support older adults to age in place. And in that service model, there's 3 pillars. So imagine all of the work that happens in community to help seniors age in place. There's sort of 3 buckets that the work falls naturally into. You have navigation and case management. So that's where you see things like social prescribing or 211. You probably have 211 in your community that helps people navigate into those services. In the middle bucket, you have asset-based community development. That's where men's sheds fits. And And then the third bucket is all those non-medical supports that help people to age in their homes. So that's everything from transportation to snow removal to elder abuse supports, senior centers, all those active aging programs. All those services are in the third bucket. But that middle pillar, let's call it, around asset-based community development, to be frank, is the thing that is most undervalued. It is the pillar that is where older adults are not just receiving services, they're building community. They're knitting together the social fabric of their communities. And frankly, I think men's sheds are the exemplar of what's possible in that space. And when I think about how community-based organizations can support that, I think part of what we can do is to educate organizations about how to work in tandem in a way that supports the leadership of folks like yourselves to create these spaces. So I think there's sometimes an instinct to step in and lead. Whereas I think when we do that, we risk stifling what is the secret sauce of men's sheds, which is to have older men lead, to have men lead in the creation of these sheds. And so how do we work in tandem to support the good work that you're doing without overstepping in terms of trying to lead, if that makes sense? So I think there's a role for groups like Healthy Aging Alberta to help educate municipalities, executive directors, funders, in terms of how to support the work of shedders without overstepping their role. So that's, I think, a really exciting opportunity. I think as an executive director of a community-based organization, one of the things that we've struggled with over the years, our goal is always to make sure our spaces are welcoming and inclusive in all ways. And so it's discouraging, you know, when you look around the room and you see men underrepresented in your spaces and in your programs. And so one of the things we were so excited about at Sage is partnering with men's sheds to increase the number of older men that are coming to our organization. And so if there's an opportunity for you through the work that you do to help the community-based organizations and municipalities understand how to create those safe spaces, how to help them understand the impact of the work that you're doing on the mental health of the folks that are coming to the shed, it's a huge opportunity. You know, as an executive director, you don't do this work because the paycheck, you know, you genuinely care. And so you are concerned when you look around the room and you see a huge swath of folks that are not represented. So by partnering with groups like Men's Sheds to be able to see increased representation in our spaces from older men, it's really, really important. So if there's an opportunity to help be able to better understand how we can improve men's mental health, I think that's really, really encouraging. I had a chance to share at the national event in the fall that personally we've had a death in the family recently around suicide. And I think that many of us have been touched by that particular issue. And I think as a community, we're all trying to learn more about how to reach the men in our lives. And so all of you now, after the last 3 days, more than ever, are experts in that space. And so I think that there's an opportunity for men's sheds to be a bridge into formal systems around service delivery for older adults. You guys are the experts, really, genuinely. You are every day, as Raz has learned through his interviews and his focus groups, you're doing on-the-ground research around what works and what doesn't work in a way that as an executive director of an organization, I'm just not able to do. And so to create bridges into formal service provision and bringing that expertise into those spaces is such a huge opportunity. I know I've learned so much from Punch and others around how we can improve the way that we work. So creating partnerships with those organizations, I think, is really important. And then in my role, in all those different hats I just mentioned at the start, really advocating for the work of Men's Sheds as a sustainable option for service delivery. You guys are, frankly, really low cost. I think we got to tell that story over and over again. The opportunity for intergenerational programming, as Raza mentioned, and I know you guys have been talking about, that the sheds are benefiting the entire community. It's not just about the folks that are showing up. The work that you do is having a knock-on effect, not just because you're doing volunteer work that benefits folks, but because the impact that it has on your families, that it has on the people around you when we improve the mental health of the folks that come to the sheds. I can say personally, I know that that's the case. and that when we increase the well-being of older men, all men, that's really foundational to a healthy community-based senior services sector. You guys are an absolutely foundational part of the sector. And I think that, we can really center that expertise in the work that we do within the community-based senior services sector. So really working in partnership to center that expertise and build a functional community-based senior services sector and amplifying that with policymakers. So I hope that's what you had in mind today, Barb, but that's what I'm excited about going forward and the conversations we're having with policymakers as often as we can. So thank you guys so much for having me today. I really appreciate it.
Wow. So Karen, thank you so much for your early and ongoing support of men's sheds, not just through SAGE in Edmonton, but also through your role with Healthy Aging Alberta and nationally through your leadership role with the Pan-Canadian Community-Based Senior Services Network. And Raza, thank you for not just your most interesting and important presentation, but especially for the work you and your team have been doing for the past 18 months or so to design and conduct the study, and for sharing your insights throughout that time, whether at research committee meetings, conferences, or in media interviews. And thank you to all of the shedders who responded to the survey and who participated in case studies and focus groups, because it really couldn't be done without you. So please join me again in thanking Karen and Raza. So I just want to conclude before we break for lunch, and I think Brian's got some announcements to make. Or sorry, lunch. I was up at 5 this morning. It feels like it should be lunchtime, Okay. Anyway, and there's snacks and everything for the coffee break, but I just wanted to conclude saying that, by now you've heard several references to the National Conversation on Men's and Boys' Health that was launched by Federal Minister of Health Marjorie Michel. Everybody heard about that or remember hearing about it yesterday? And yeah, good. So this is a really important nationwide consultation that will inform the development of a men's and boys' health strategy for Canada, which is long overdue, as Robert mentioned yesterday. And every one of you can participate by completing the survey on the website. There you go. And you probably can't see the address, but just Google National Conversation on Men's and Boys' Health. You can also, your shed can submit a brief. There's that opportunity too. And Men's Sheds Canada will be submitting a brief. These are due by June 1st. And all of the survey results and the briefs that are submitted will inform that national strategy. So we really encourage you to participate in that. I know many shedders already have as soon as it was announced. And I've also participated in meetings and consultations that Movember has been organizing on this. Now, we also want to remind you, I've mentioned it in some groups, that we have a new advocacy and government relations toolbox. You may have seen the cover printed out that's on our Men's Sheds Canada exhibit in the Shedder Showcase. You can go to the Shed Hub and download parts of that, and there is a tool there or a document that just describes the national conversation opportunity to submit something. And I think Raz's presentation this morning also gives some very powerful data and language that anyone can use. If your shed or if any of the provincial associations want to submit a brief, there's a lot of great stuff there. And certainly I'm using some of it and I just learned from Karen this morning that the deadline has been extended, thank goodness, for the federal government's pre-budget consultations, because we're submitting documents and briefs to say why we should be supported, why the men's shed movement should be supported in Canada. The deadline was tomorrow, so I've been a little stressed about trying to get that in. But the good news is I just learned from Karen that it's been extended by a few weeks. So lots of important data, stories, and information that you can use, and we really encourage you to participate in it because you've got very powerful voices. We do have the ear of government and a lot of other stakeholders now, and so we want to be able to use our voices to bend those ears. So thank you all. Brian, if you can want to do your announcements, and then we'll not have lunch, we'll have a coffee break.
Yeah, thanks, Barb. I just want to reiterate how a couple of the important things that from this morning for me that Raza has put and his team have put in so much effort in gathering the evidence that men's sheds work. We all know it, but we have to convince government to change policy. We had to gather that evidence. So this is really important work that's being done. And the other thing that Karen mentioned is about the important that community-based organizations don't start sheds, they empower them. They help us find the space. And when I happen to be involved with helping a lot of guys start, it's very, very often, especially here in Alberta, the community-based organizations, and in fact, and most of those are women, but they help us get started here. They help us find the space and the resources, and they connect the guys. So it's very, very important. It's worked so well here in Alberta that we have the support of the community-based organizations. They've been a big part of our success. So thank you. I also want to remind us all that so many little things are being taken care of by volunteers here. And unfortunately, they're not wearing the yellow vests, so they often don't stand out. There's some of us, but so much volunteering is going on behind the scenes. And I want to give you one example. A couple of guys showed up yesterday needing a ride and had a last minute volunteer. Just, the agreement was the driving from the airport to the Holiday Inn. Well, his name he's not here today, but he's an Edmonton shedder, Gary Burt. Are you here today? And no, he's not participating, but he picked him up and he gave him a 3-hour tour of Edmonton. Like, to show off our city. And he just said, thanks, have a great conference. Right? And for Doug and Buster. And so, wow, that's hospitality, right? So we're very proud of that. And now we just got a little bit more to do. And that is about the rides. I know that some of you and most of you from out of town. And so we wanted to make sure that we can do our best to get you a ride back to the airport. So where there was the map in the main foyer, now there's a big white